Okay, I've got a presentation for you guys today on Achilles pathology and injuries, as well as plantar fasciitis. So enjoy the slideshow, as well as some videos at the end. My name is Jacqueline Rose. I'm the owner and operator of Jacqueline Rose AZ Life. And I would like to give you a little quick background and bio. And that would be my background as an ATC, working in a sports medicine doctor's office, doing one-on-one treatment and therapy with his patients for the past 10 years. I now own and operate this online-based service for the public to share these tips and general information for you. So as you can see, and I'll follow along with my cursor here so you can see what I'm pointing to. This is the general anatomy showing the attachment of a gastrocnemius into, and as it follows down, into the Achilles tendon attaching behind the heel. The Achilles tendon itself is this long connective tissue. It's a band of tissue that connects the heel bone to the end of the calf or gastrocnemius. Achilles injuries can result due to a variety of factors. Injuries can be acute and happen suddenly or happen little by little over time. Here's another side view. This is where the tendon attaches to the meaty part of the muscle belly of the gastroc head, which there are two of. And then the back view of it inserting here on the calcaneal bone. Okay. Just a little disclaimer for you. Moving on here, I've got some anatomy and side view of Achilles tendons include that occur. And I've got, of course, my Michael Jordan. Basketball is a very common sport that involves Achilles injuries due to the high velocity and nature of the push-off phase and jumping, and the plyometric and quick plyometric responded by eccentric load on the landing of jumping. As in any other sports that involve jumping, these are more typically associated with acute trauma, which you can see down at the bottom. This is a ruptured Achilles tendon. This can happen in dancing, volleyball, jumping, plyometrics, these kinds of pulls on the Achilles when it's not trained properly. More common outside of high velocity exercise would be some of the more gradual or degenerative changes that happen to the Achilles. As you can see, this is a normal healthy Achilles tendon. This is tendinitis, which is a thickening and inflammation of the tendon, shown here by this visible swelling, or what's called a fusiform swelling. I'll get into that later around that tendon. In this similar area to do with inflammation could be bursitis. It's inflammation of the bursa sac. I'll show you that in a minute as well. Tendinitis versus tendinosis basically is the duration of the symptoms is the determining factor, as well as in tendinosis, there's more breakdown and tiny tears of that tendon. This is typically what happens over time, whereas tendinitis is a bit more acute. And maybe with more of a rapid change in stress to that tendon compared to little by little over time, tendinitis can essentially turn into tendinosis. If untreated, tendinosis can also lead to a ruptured tendon. So if those aren't addressed and treated and people continue to push through pain, that can happen. So shout out to my Bulls fans out there. All right, so this shows a breakdown of the section of the Achilles. The upper part here is kind of like the image showed before, is where your tendon attaches to the muscle belly. This is the musculotendinous junction of the Achilles, the higher portion. This is the mid portion, consisting of 2 to 7 centimeters. Everybody's anatomy is different, so the length will vary. And then the insertion of the tendon. This is important because tendinitis or tendinosis can occur at any of these locations. It doesn't have to be the insertion or the mid portion or the musculotendinosis necessarily, although insertional and mid portion are much more common. But nonetheless, at times, tendinitis can occur more higher up where the muscle tendon attaches to the muscle itself. Here's a little view of the anatomy at the insertional site of the Achilles tendon. This would be insertional Achilles tendinosis. This will be very prominently painful to palpation and touch right at the heel bone itself, and then a few centimeters up above at that point as well. Insertional tendinitis is treated pretty similar to the other styles as well, other diagnostic regimens as well. We'll talk about some exercises and treatment for that in a moment. This third picture shows some of the deeper anatomy structures that exist besides the Achilles tendon. This blue area here is the bursa. A bursa is a fluid-filled sac of tissue that exists all over the body in places where you have a tendon gliding near a bone. It's there to lubricate and reduce friction. That being said, if friction occurs rapidly or acutely in this area, the bursa can also swell. This would be seen with large amounts of swelling around the heel bone because there isn't a lot of soft tissue space for that swelling to go. You would see a very thickened Achilles tendon if the bursa was swollen, and you would often see it swelling up into the mid-substance of the Achilles as well, because there isn't much area for it to go down here by the heel and fat pad. There's also a small bursa, shown the red one here, that's called the retrocalcaneal bursa. This is gliding and protecting the tissue, the tendon on one side where the bone attaches, and this one is more protecting it, the subcutaneous bursa, where the bone and tendon articulate to the skin. So there are two bursas. The Achilles tendon is also shown here, but I want to connect here how Achilles, the function of the Achilles tendon, serves and is connected directly to the plantar fascia. As I correlate these two together, you will find that their tensile ability to flex and stretch, and also power elicited through strength, are directly connected to one another. The Achilles tendon extends down the calf and leg, like mentioned before, into the heel. And then under that calcaneal bone starts the plantar fascia, which is a connective tissue. It creates the arch of your foot. And hence, if you touch underneath your foot, that would be the first prominent tissue you'd be touching underneath the skin. Plantar fascia then extends down into the metatarsal heads at the base of these, where the ball of the foot is. This shows some inflamed tissue here toward the insertional site of the plantar fascia. This can cause exquisite tenderness and pain under the heel, where you step with each stride. This is where often people will use inserts or other kind of heel pads to give some relief to that tissue. And again, the correlation of the two. As the Achilles tendon contracts in the push-off phase, like shown here in this picture, the plantar fascia also contracts, which means they are both shortening, and vice versa on the extending and elongating phase through a walking stride, let alone running and jumping stride. When one elongates and stretches under compressive forces, so does the plantar fascia. They work together. This image shows some overuse and painful inflammation responses to the plantar fascia. Plantar fasciitis can lead to heel spurs, I'll show you some images of that in a moment. The tissue can also tear. As the inflammation continues, the pain and progressive damage can spread further down the foot. Some of this inflammation you'll feel mid-foot, some of it's closer to the heel, depending how far that inflammation is spread and how acute it is. This is a ligament of connective tissue. This shows the Achilles tendon inserting onto the heel as well as the plantar fascia. Again, the correlation of the two muscles and tendons and how they work together. I like this view because it shows the plantar fascia here supporting the arch of the foot. The plantar fascia tensile strength as well as anatomy and movement of the foot and how flat your foot might be or how high arch the arch of your foot might be also depicts how the Achilles tendon and plantar fascia are functioning and their integrity. This is a great view showing a flat-footed person. In this view, you can see the lines producing an angle out of alignment. This middle foot here is collapsing. The arch of the foot is collapsing. The foot is then turning in. The ankle is turning in as well. So the arch of the foot isn't being supported by that plantar fascia. Over time, depending on someone's laxity in their ankle, maybe injuries to the ankle, this problem can essentially just worsen. This is a pronated foot. So what that means is the ankle is turning in, the arch is then collapsing. Also known as a flat foot or collapsed arch. There are ligamentous structures that support the arch as well that can stretch or be damaged over time. Essentially, this would add to a problem and the chronic issue related to plantar fasciitis or Achilles tendon issues. And if one isn't corrected, or if this issue isn't corrected, the problem and the pain will often resurface and come back and become chronic. You can strengthen your arch in a number of ways, through balance, through walking barefooted. If the arch collapse and the flat-footed issue is extreme, professional custom-made inserts and orthotics are sometimes recommended. There are therapeutic exercises that assist this as well. And I wouldn't caution against looking up into higher sources of the body and how this can correlate to knee issues and hip issues as well if this isn't corrected early on. This shows a heel spur, which is basically inflammation pulling on that plantar fascia over time. The reaction to that overstress is then pulling on the bone, creating an overgrowth of the bone. The bone deposits calcific densities into the tendon often, and this is represented here by this spur, this pointy tissue that is obviously very painful as well, that hits into the soft tissue pad of the foot. This is, again, a stress reaction over time to tight Achilles tendons, tight plantar fascia, overused muscles, overused and irritated tendon and tissue. A lot of overuse type of sports can cause this, or rapid increase in intensity without a gradual progression to your exercise and or activity throughout the day. This would produce pain underneath the heel, extremely painful with walking, depending on how supportive the arch is in your shoes and what you're wearing as well would depict that intensity. This is an X-ray view of that heel spur. And you can see the shape of the bone here and this overgrowth. It should be a nice smoothed off surface and rounded, but it's not. So X-rays can determine the extent of plantar fasciitis, especially in the chronic nature of them, and how far advanced it has become. Before I click some of these videos for you to see the exercises, I'd like to suggest some of what treatment plans may look like when you're dealing with plantar fasciitis and Achilles tendons. You may have been told by your practitioner to rest, to apply ice, to apply anti-inflammatories, corrective orthotics. Sometimes when the symptoms are very acute, you'll have immobilization devices that are used to keep your weight off of that foot and leg. In some cases, more invasive procedures exist as well that include injection and even surgery. Ultimately, with inflammation and Achilles tendonitis and tendinosis, it's something not to take lightly, to actually correct and seek counsel and seek your medical provider so as to avoid further damage and rupturing. How long these conditions last vary by age. Of course, as we get older, our bodies heal slower. Depends how active one is or if they are in fact resting. Depends how long the issue has been going on to begin with. If you have further questions, please follow up with your practitioner and enjoy these next few videos showing some exercises that you can be doing from the early on stages when it is acute, as well as when it starts to become subacute and improves. And I will specify that in the videos. Thank you. Off the curve of my doorway here, I'm going to step back 1 foot so that heel drops down below parallel as much as tolerated. So you might be doing this gently in the beginning until it gets more flexible, but if you can tolerate it more, push a little harder. More important for aggressiveness is the frequency and the duration, more so than the intensity, especially if you're having acute symptoms under your foot and through the Achilles itself. So I'm holding this for 30 seconds. After 30 seconds, go ahead and bend your knees, so kind of squatting down. Now you're going to get more of a soleus stretch, which is lower toward the Achilles. The more flexible your shoe is and the more your foot bends, the more you'll feel it into the bottom of the foot as well. The tightness of your plantar fascia, though, remember, the tightness of the Achilles and the tightness of the bottom of your foot is interconnected. So if you're feeling it just in the Achilles, that's great. If you're feeling it only in the calf, and you want to try both of these poses. After 30 seconds, I'm switching legs. Now this is something you should essentially be doing if you're having symptoms under your foot and into the plantar fascia or tightness in the Achilles tendinosis, all the above, several times a day, 3 to 5 times a day. Again, both positions, both legs. Stick to equally. You may just have to be more gentle with one. An alternative method, if you don't have a curve or ledge, you can simply stagger your feet and get into a kind of a squat pose from here. You can also put your foot up on a wall or ledge. Let me show you this way. And lean into it this way as well. Okay? Those are the Achilles stretches. And again, consistency with aggressiveness and frequency is the key in doing that throughout the day. Thank you. Okay, so I'm going to show you these aggressive Achilles stretches. Off the curve of my door. So I'm going to show you plantar fascia massage underneath the foot using this Rogue Fitness massage ball. It's really firm. If you have something hard, ideally, even a golf ball would work. So I'm going to put it under my foot and literally massage underneath my foot. So I'm rolling it over the fascia and that connective tissue where your symptoms would be. It would be sore. You could do this sitting at an office space and under the desk. Keep the shoe off and do it. Both feet, spend about a minute or so each, is tolerated. And again, something firm, ideally, and you decide how much body weight and pressure you put onto that. So these 2 exercises to alleviate tension and alleviate symptoms with plantar fasciitis, or also the prior one with the Achilles stretch for any Achilles pathology. tendinosis, tendinitis, and even, calf strain. So here's plantar fascia massage. Thank you. Okay, so lastly, I'm going to give you some strengthening exercises for the Achilles. These are specifically eccentric strengthening. So when you hear that word when it comes to strength training, think elongating the muscle while it's under load. You're not shortening it. It's like a bicep curl. You're shortening the muscle from origin to insertion. Eccentric load is lengthening the muscle under load. So this is ideal for strength training that mimics the way the Achilles is actually functioning during a walking stride or running stride, or in plyometrics during that push-off phase, and how it's having to stretch and contract at the same time. So eccentric should be done very gently and progressively. Anytime you're doing eccentric loading to a muscle, it's much more intensive. You'll feel a lot more soreness and residual effect from that. If it's preventative, you can be progressive a little quicker. If it's in more of a subacute stage, I wouldn't do this in the beginning stages when something's flared up or swollen or acute. But subacute, you can begin these eccentrics safely as tolerated. So quick demonstration from the side view. I'm just going to hold the wall at the door here for a slight balance. Got both feet planted. I'm going to go up into a calf raise. That would be your concentric load. But I'm going to shift weight to one leg and then slowly lower back down. Assisting the way up, 2 feet, slowly back down. So that's your emphasis is on the way down. I'm giving it help on that shortening phase, the concentric load, to not pull and irritate the tendon or plantar fascia. 1 foot, controlled, slowly down. So a progression to that could look like this, where you're just kind of gently assisting with the other foot, but most of the weight is single leg. If it's too tender, you decide how much weight you can tolerate on that side. To make it harder, you can do this off of a ledge or a step. So now you're getting that negative motion on the way down. Still 2 feet up, 1 down, but now the heel drops down lower because you're off of a ledge or a curve. And eventually, as a preventative stage, when you're not having any symptoms, not painful, this can be all done on 1 foot. Up, but focus on the way down. Get that long, slow, eccentric load on the way down. Okay? Thank you. Thank you for coming on today. You can follow me here at the links below. Appreciate you taking your time and watching. I hope you learned something. And go ahead and subscribe to the channel if you'd like to follow more prevention and wellness videos and practice better self-care in the process. Thank you.